Hello friends, I'm Dr. Archana Kavalakkat. I'm Pediatrician and Neonatologist and Asthma Allergy Specialist practicing at Cure Hospital. I'm here today to demonstrate the use of inhalers and these devices called as spacers for the use of asthma. We are all aware that for asthma, we have revolutionized the treatment of asthma with the use of inhalers. And I'm going to demonstrate how inhalers are to be used correctly so that the effect of the drug is got in the most optimum fashion. Wrong use of inhalers leads to the misconceived notion that the medicines are not working. And due to this, you may lose a very important form of treatment, a very effective form of treatment. So let's see how these inhalers are used. There are two types of inhalers that are generally prescribed to you. One is a blue or a green colored one. This is called a reliever inhaler. It gives instant relief to a patient who's suffering from breathlessness or acute wheeze. Then there is another inhaler which is white in color, and this contains a steroid and sometimes a drug along with the steroid. This inhaler is generally white in color and it is called a controller inhaler because it controls your disease over the months or years that it has been prescribed for. So these inhalers can be taken directly, but it's always better to use a spacer. A spacer is a device which looks like this. It is an oblong shaped device where it has a portal here for attaching the inhaler, and from here you have to take a breath. In children more than 4 years of age, we use an inhaler, we use a spacer which has no mask here. So the child has to put the spacer directly in the mouth. For younger children, we use a spacer which has a mask attached. That is less than 4 years. We prefer the mask to be there because these children don't know to breathe properly from the mouth and they may keep breathing from the nose, and you might feel that the drug has gone in whereas it has not. Now, how does one use it? I'll demonstrate it on this spacer which is without the mask. First, the brand new inhaler that you bring, you have to waste the first 4 puffs by letting them out in the air. This way, at least 4 times when done, you have primed the inhaler. This has to be done only once when you buy a brand new inhaler. After that, you have to follow the process the way I am saying it. Shake the inhaler well. By shaking, the medicine is brought right to the tip of the nozzle. Shake the inhaler well, connect it to the spacer, the notch that is there. What you have to do here is, before you put your mouth there, exhale. Throw away all the air. Put your mouth here and clasp it tightly with the lips. Once you have done that, you press the inhaler and take a deep breath in. Hold the breath for 10 seconds and release. I'll demonstrate it. Shake the inhaler well. Attach. This way, the inhaler has to be 1 puff. You has to be followed by 5 deep and long breaths while holding the breath for 10 seconds. In smaller children, they may not be able to hold for 10 seconds and they'll hold for a short time, but that's okay as long as you follow this process of taking a deep breath and trying to hold. Once that's done, suppose the doctor has recommended 2 puffs of the blue or the green inhaler. Shake it again, attach it, and repeat the process in the same fashion. Don't press twice at the first go saying that, oh, I gave 2 puffs. 2 puffs have to be given, one followed by the other. If the white inhaler is also to be taken, remove the green, Take the white, shake it, attach it, and repeat the process with this. Once you have taken both the inhalers, you have to rinse your mouth. In a child who doesn't know how to rinse the mouth, ask them to sip 1 or 2 sips of water so that any medicine inside the mouth is thrown away. Okay, so this is about this inhaler and spacer. Now when it comes to use of the Huff Puff kit or the spacer and the mask, all you have to do is follow the same process. Shake the inhaler, attach, place it on the child's mouth so that it's a tight fit around the nose and the mouth. Air should not leak out. Once that's done, press once. And when you press once, keep it in contact, the mask in contact with the mouth for at least 30 seconds to 1 minute, by which time the medicine would have gone in. Okay, so I'll just show you how. Shake, attach, so this is done for 30 seconds. That's more than enough. Up to 1 minute is good to do. And again, after this as well, give your baby or child less than 4 years a sip of water so that the mouth gets cleared. So this is the way inhalers are used. Care of the inhaler, the spacer and the mask is prescribed on the box that you buy. Cleaning with warm soapy water once a week and inverting these 2 parts and drying it out on its own without using a cloth is the best way to do this. Use your inhalers in a proper manner with the proper technique, and don't forget to change the inhaler once you start reading 20 in red. So when you have 20 counts left and it starts looking red, the meter, there's a meter here, it means that your inhaler is on its way to be finished completely. So please purchase a new inhaler and start using that one. So this is the way inhalers, spacers and masks can be used. If you have any queries, you can put messages under this video. Thank you very much.